Welcome, everyone. I'm Maureen O'Connor, president of Palo Alto University. Palo Alto University is dedicated to addressing the pressing and emerging issues through research and training in the fields of psychology and counseling. It's my pleasure to welcome you to our Mental Health Awareness Month webinar. Today's discussion focuses on disparities in access to and culturally competent care in communities of color. The pandemic has only exacerbated and heightened our awareness of the stark health inequities in this country. Those inequities extend to mental health care. Today, I'm joined by Dr. Elena Herrera and Dr. Donya Wallace, who will discuss the barriers and challenges that exist for racial and ethnic minorities in accessing mental health care and in the resources that support and affirm cultural identity, community, and healing. Dr. Elena Herrera is a licensed psychologist in California and the assistant director of PAU's wonderful Gronowski Center, where she provides clinical supervision to doctoral students enrolled at PAU's PhD and PsyD programs. Elena also has a private practice in San Jose, California. She's a bilingual therapist and has worked in community mental health, juvenile justice programs, and college mental health programs. Welcome, Elena.
Thank you.
Dr. Donya Wallace is a counselor educator and visiting assistant professor at PAU in the counseling program. Dr. Wallace has her PhD in counselor education and supervision from the University of South Carolina. She's a licensed professional counselor. In 2018, she received recognition for her work with underserved populations and has been named an emerging leader in her field. Dr. Wallace's scholarly interests include wellness among African American women, the strong Black woman archetype, implicit bias, and mental health care disparities in the African American community. She also has a small private practice situated in a rural community in South Carolina. Welcome, Dr. Wallace.
Thank you so much.
So let's start our discussion today by sort of framing out the issues a little bit. The evidence is clear that the pandemic and the racial injustice exposed in recent times have caused both health and mental health stress and distress to many in the population. But we also know that these effects are not experienced uniformly among racial and ethnic groups. In a recent review of issues relating to disparities in mental health status and mental health care, the American Psychological Association stated that mental health care is an underaddressed issue in racial and ethnic minority communities. The APA points out that many people in those communities experience symptoms that are undiagnosed, underdiagnosed, or misdiagnosed for cultural, linguistic, or historical reasons. We recognize the importance of this issue and want to help our audience today understand the scope of the issue and ways in which we can begin to address it. So let's start by focusing on the state of affairs. Let me ask you, Donya, what are healthcare disparities and how do they impact racial and ethnic minorities? Can you start us off?
Absolutely. Thank you for that question. Mental illness is a global burden. It affects all populations across our world. What we know here in our country, though, is that people of color are pretty equally impacted by mental health issues. But there are some differences in the ways in which people of color have access to the resources that they need in order to maintain good mental health. So as you can see here on the slide, if we look, for instance, at Hispanic populations, we can see where 27.3% actually sought out services compared to white populations at 46.3%. So we're seeing that number almost decrease by half when compared to Hispanic populations. And even if we look at the numbers between African American or Black populations compared again to those white populations, we see where that number too is almost half of those of the white community. And so, despite there being no significant differences in the prevalency rates for mental health disorders, we do see a pretty significant difference in the help-seeking behavior among these different populations.
So the access to care issue that Donya mentioned, Elena, is a serious one. Do you want to comment on that?
Sure, that's a really good question. I think specifically for the Latinx population, what we often have to think about is language services, culturally appropriate and linguistic available psychotherapy services. We've got a number of monolingual Spanish speaking individuals, and unfortunately, we just can't keep up with the numbers. We don't have enough providers who speak Spanish. And even for those individuals who speak English fluently, when it comes to mental health and talking about mental health and seeking psychotherapy, we often revert back to our first language. So even if we've adapted well to being here and if we speak English very well, it's quite another to access vulnerable parts of your life, and that ability to be able to code switch and to have a therapist who understands and lives in the community, I think is one of the access barriers that I can think of, at least for the Latinx population.
Are there other cultural competency issues that we need to be concerned about that address this scope of the problem?
Sure. So in some cases, when we do have situations where clients feel comfortable actually going into a provider's office and asking for assistance, sometimes there are communication difficulties between the provider and the patient, and that the patient may be experiencing the symptoms in one way and attempting to articulate those symptoms in ways that are culturally descriptive of their experience, and it may not be a manner of speaking that's familiar to the practitioner. And so we kind of have that miscommunication going on there. In addition to that, some members of minority communities have stereotyped beliefs about what happens in a clinical session, and that may significantly impact their decision to access treatment and remain engaged in the treatment process. So there are a lot of different dynamics going on here. We often think about it from a social ecological perspective, where we're dealing with the interpersonal dynamics of the client or the patient. What dispositions do they have that might impact their access and willingness to accept treatment? We're looking at it from an interpersonal perspective. So what sort of stigmas in the community, right, might be impacting their help-seeking behaviors? What are potential provider biases that may come up during that initial visit? And then on a sort of a grander scale, what sort of community supports or access points are in place? For instance, is the provider's office located on a bus line for members who may not have access to transportation? Is there a community mental health center that is easily accessible, or are we asking patients to, get across town? Is there a local pharmacy where they can have prescriptions filled? And then on an even grander scale, at the macro level, national, regional, and state rules around use of Medicaid or Medicare. Is there funding available? Are there limits on the amount of care that patients can receive that's being dictated kind of by these macro corporations that have direct impact on patient care and patient needs?
And that's really just to get in the door, right? You're just trying to get people in the door. So lots of barriers to just get in the door. And then we know when people do come into therapy, many do not continue. Why do we need to pay particular attention to these mental health care disparities now?
I think it's always been an issue. It's always been important. I think what's different now is that we're talking about it more. And I think certainly with the pandemic that we are still in the midst of, we're not completely out of it. There was, for at least the first time that I can really recall, a lot of attention being paid to the person as a whole, the person physically, the person mentally. And everyone was stuck at home. And then some people were not stuck at home. Some people had to be frontline workers. Some people had to be in the healthcare industry. Some people had to be working in restaurant chains and being worried about getting themselves sick or their family sick, and the constant stress. And we saw the disproportions in the numbers of who was getting infected, who had worse prognoses. And so I think it kind of naturally led to this conversation of how is this affecting people emotionally? And so I don't think you can separate the two. And I think so for once, there's kind of an integrated conversation of how something like a global pandemic affects mental illness. But then certainly right as the pandemic really began, we had racial injustice going on with very public death of George Floyd and what that did as a nation. And so the attention to the racial trauma of seeing people in the community being killed, seeing them being discriminated against, and the racism. And so understanding the racial trauma and how that affects and how that is post-traumatic stress disorder and how that's affecting everybody as a community. It's, like I said, more integrated. We're not ignoring it. We're talking about it more. So I think it's always been important. It's just more of a conversation these days.
The power of thinking about the health consequences, right, to families, the economic consequences, the grief for families who lost loved ones, right, then haven't even really been able to adequately deal with that grief, and the racial trauma issue that you raise. I mean, that's a powerful set of circumstances. And Donya, is it your sense that mental health professionals prepared for that combination of impacts on the person? Are they going to ask about those issues? You know, what do we know about how that plays out and when people seek care?
So, of course, 2020 and 2021, really years that we've never seen and never would have imagined the level of grief and trauma that's being experienced by individuals worldwide and certainly here in our country. And so mental health professionals really were initially very overwhelmed, you know, and you have to consider that, you know, we were asked really at a split second to move from seeing clients and patients in person to a virtual environment because their need for our services never dwindled. It never went away. As a matter of fact, it intensified, where we started seeing numbers of patients, numbers of requests for services that were never imaginable. And so mental health practitioners had to very quickly learn how to adapt treatment modalities, assessment measures to an online format that was easily accessible to patients. And that in of itself is another disparity when it comes to providing services to racial and ethnic minorities, because we do see where, you know, there is that lack of access to the internet, sometimes lack of access to a working computer. So it has been challenging. And of course, while we are attempting to provide services, we ourselves are dealing with our own grief issues. Many of us were impacted directly by COVID-19. Those of us who are very invested in social justice for our world and our nation were impacted by the incidents of 2020 with George Floyd and Breonna Taylor and so many others. And so trying to figure out how to effectively manage our own stress and trauma and grief issues while also holding space for clients has been a bit of a challenge. And we are still figuring out how to make that work. And so in years to come, I think as a profession, you know, mental health and counseling and psychology, as a profession, we are going to have to kind of take a moment back and see how we have changed, how the profession itself has changed and been impacted by the events of the last couple of years.
I mean, I think that's such an important point. We don't, you know, we you know, as consumers of mental health services, we don't think about all that the therapist also is dealing with in their own situation. So that combination is very powerful. It has implications, I think, too, for how we go about training our wonderful students, right? We're going to really have to think about those issues. So Well, it's clear that we have a serious issue to address in this country around mental health disparities and access to care. But, you know, we, as Elena, I think you mentioned, this has been around for a while. I mean, we've known about these issues. I think it was 2000 was the, you know, first major report on healthcare disparities and pointing out these issues. So let's talk a little bit about how have we tried to address these issues? I mean, obviously we haven't solved the problems, but how has the fields of psychology and counseling in particular, how have we tried to address these mental health care disparities?
You know, I've been in training or been out of training for a number of years now. I'm not going to age myself, but it's been a number of years. And I can say that when I was in training and from now providing the training, there's a drastic difference in how we talk about providing care for racial and ethnic minorities and people of the LGBTQ population. Whereas before it was maybe one class that talked to us about these issues. Now we see training programs, whether it's terminal master's programs or PhD and PsyD programs, now having emphasis areas in how to provide care. We see specialty programs, we see specialty clinics. Speaking on behalf of the Gronowski Center, which I'm very proud of, our training clinic through Palo Alto University, we have Clínica Latina, which takes a number of students every year and has them work in the community. And they have the very unique opportunity to train in Spanish, which I can tell you from experience anecdotally, but also I know there's research out there to support it, that many times bilingual providers are trained by non-bilingual supervisors. And so our program is very unique in that we have highly trained supervisors who speak Spanish, who understand the community, who are part of the community, and they are training the next wave of psychologists to be bilingual and bicultural. So clinical training, it has changed dramatically. And so now it's just a matter of a pipeline of catching up to speed. And so in a few years, we're going to have you know, many more licensed providers who also speak Spanish. And so we're going to catch up eventually, but right now we're kind of stuck in, have a whole lot of people training and we need people to get licensed out there, but it is on the way. So I can say, at least for efforts that are being done, clinical training has really changed courses.
For a long time, it was as long as we had a course and we could check off that we had the course, we thought we had done our job. But Donya, maybe you could say a little bit more about culturally competent care and how that has evolved and looks like now.
Sure, yeah. So as far as counseling is concerned, you know, we have embrace this idea of providing culturally responsive or cultural humility in care so that we respect patients' and clients' cultural needs, their cultural identities, and we are increasing our efforts to acknowledge the importance of those differences and find ways, responsible ways to incorporate them in the care we're providing patients. So an example might be, we know that in minority populations and specifically African-American communities, we know the importance of family involvement and those sort of kinship ties. And so finding ways to incorporate family members as part of the treatment process is one way to help patients in need stay connected with their providers, because there's now an additional sort of resource or person involved who can make sure that that individual is following up with care. But it also helps, I think, to normalize mental health, right? And the need for mental health. The more family members, the more important people that we can get involved in that patient or that client's mental health care, the more we can kind of push back at some of those stereotypes that discourage seeking and treatment or taking medication or really staying involved. We're seeing a lot more kind of collaborative care going on the clinical side where practitioners, medical and counseling practitioners are working together to ensure that the needs of the patients are being met. And in some cases, we see medical practices that are bringing in mental health practitioners, having them have an office in the clinic so that patients aren't getting kind of lost in that referral process. We don't have to wait long periods of time for an appointment or worry about the patient not feeling comfortable going into a counselor's office or a psychologist's office or psychiatrist's office for care.
I think that's really important point that, the handing someone a piece of paper with a phone number on it is probably not the best way to ensure someone gets care, particularly in communities, as you say, where there may be stigma, there may be, may not be a community support in understanding of some of these important issues because of the lack of access to care that has gone on in those communities. So, I think there's some pathways that you both have identified of things we've tried, and I'm wondering if we could think a little bit more. What more could we be doing? Where could we be heading with some of this work? Are there innovative approaches or models? It sounds a little bit like you're talking about integrative care, Donya. Maybe you could say even a little bit more about how important that is. But are there gaps in our previous efforts, and what innovations could we use going forward to address these disparities?
So we're seeing medical providers doing more depression and anxiety screenings in their offices, which has been really helpful because that then invites a conversation about mental health, right? And then that also invites opportunity for sort of that soft handoff with the trusted medical provider going over the results of that screening tool and talking about the importance, and then directly connecting that patient with a mental health provider that can meet their needs. That psychoeducation piece is also really important. And if it starts with that trusted provider, that medical provider, and the clinician then can kind of continue that effort, we're seeing a lot of that happening now, but that's certainly something that we want to make sure continues. A lot of patients, when they come into the office, they'll sit down with me and they'll say, okay, Dr. Donya, I'm not crazy, but, right? Because they're experiencing these symptoms. They don't know why, they don't know what the symptoms mean. And their first thought is, I must be going crazy. And so that psychoeducation piece is so very important, and normalizing a lot of those experiences. Creating centers that are based in the community, that are accessing those community networks that are already in place, are some of the initiatives that we're seeing, that are kind of springing up now and really need to, kind of continue, I think, across the country, because they are proving to be really, really effective in these centers. As Elena was saying, the emphasis is on kind of this holistic approach to care. So we're seeing the medical provider, the mental health provider, we're seeing case management services all in one place. It's sort of like a one-stop shop for communities in need. But certainly it's helping to make a difference and an impact in communities that have been fortunate enough to kind of take that approach.
One of the things that we are, there's a project going on at our university around the importance of religious leaders, right? I mean, I think there's sort of been this, either you do that or you do, you're either
Right.
talking to your religious leader or you're talking to mental health care. Have you seen any progress in sort of that realm as well?
Oh, absolutely. And that's a big one, right? Because one of the stigmas in the African American community is if you are seeking mental health treatment, then that means that you are not spiritual. You're not praying enough. You're not active enough in your faith. And so what we are seeing now is where churches are starting to bring mental health centers into the church. normalizing the experience of seeking mental health care. And that has made a tremendous amount of difference in those areas.
Anything on your end, Elena, in terms of, seeing, I love these innovations. I think we need to be in support of those. Are there other ideas, even on the clinical training side or in your practice areas?
Yeah, so I think with the innovation and also clinical training, one thing that I think is really important is if we want more people to screen for mental illness, there needs to be training on how to screen, because certainly the language, not just the language barrier, but how certain communities even talk about their symptoms, what it means. So Donya was talking about, it must mean that I'm crazy. And, I worked with a number of primarily Latino men who would describe having flojera, which means laziness. And so many people, particularly in older generations, are not going to say, I'm feeling sad, I'm feeling hopeless, but instead they're going to be complaining of body aches, feeling lethargic, feeling apathetic, feeling irritable. And there certainly are, gender differences as well. And so helping practitioners and helping students in training to understand what kinds of questions should you be asking and what should you be looking out for? Because anyone could read a screener and say, this doesn't apply to me. I don't know what that word means. Or, well, if I circle that, it's going to mean this. Oh, but I can tell you that my back hurts all the time. I can tell you that I'm feeling tired, that I'm snapping at everyone around me. So it's certainly the assessment piece that has to be emphasized as well. And with all of these new types of integrated healthcare, which I'm all for, we also need to take a look at caseload size. We need to take a look at who's providing the services and what's being done to support them, because you can't talk about the clients and access to services if you're not talking about the service providers. We are oftentimes living in the community and affected by those same community, social, environmental aspects as our clients are. And if we are in the role of provider, of caretaker, and no one's looking out for us, and if we have enormous caseloads, what kind of care are we going to be able to provide? And when we are providing for impacted communities, the work is different. The work can be harder, extremely rewarding, but it's tough. And so we need to not ignore the provider end of it. And I think sometimes that's where we get left out. So certainly it's a funding issue. If the number of clients accessing services increase, then we need to keep up to pace and have enough providers so that there isn't an overload of clients per one particular person.
Such an important point. We had a discussion, a webinar several weeks ago on this very topic of compassion fatigue, right? The provider themselves, keeping out of that burnout state, right? Not having this become overwhelming. But I'm hearing so many things. I'm hearing about, the sort of micro counseling skill development in others, right? Teachers, nurses, doctors, other religious leaders, right? Other types of community members who can be perhaps, better trained or better supported in how to be looking for these issues. But I'm also hearing you say that we might not have the assessment instruments we need. I think there's room for, if any students are listening, there's room for some dissertation work on really looking at those instruments and making sure they're ready for various communities, right? That they really are meaningfully assessing the issues, and besides just linguistically, right? There's a lot of, you really raised a lot of really good issues. And then of course you've both mentioned the importance of racial and ethnic minority mental health professionals and increasing that pool. There's a lot of work to do, but I think we have some paths toward improvements in these areas. I mean, you've kind of touched on this a little bit, but are there any specific issues or subgroups in need of attention and advocacy, even within the racial and ethnic mental health disparity field? Are we missing some special needs here?
For somebody who was born and raised here, their challenges are going to be significantly different from an individual who was not born here and is dealing with immigration status and the anxiety that it can arise. And I think there has been some degree of reduction in anxiety with the new presidential administration. However, it doesn't mean that the problems of immigration have not gone away for those individuals. So I can speak specifically for the undocumented community, the fears of deportation, the fear of family separation and the stress, and how is my neighbor? How are they viewing me? Am I going to be found out? So that's a population within the Latinx community that I think is constantly under stress, more so in the last several years, but something that is not entirely going to go away. And so we've got a number of young individuals who were not born here, but this is the only country that they know, and living in a place where they're getting mixed messages about their value and their worth is a daily barrage of stress. And certainly those people who have been living here and working here and try to provide for their families. And that is a huge amount of stress and fear to live with the possibility of being separated from family.
Such an important point. I mean, that think of the stress really doesn't even capture what the depth of that, right? I mean, it's really a profound challenge to live under that kind of situation. So thank you for raising that. Donya, did you want to add to that?
Yeah, I'm thinking about the LGBTQ plus population, racial and ethnic minorities who identify as members of that population, are kind of hit with double whammies sometimes when seeking treatment. They often have to deal with providers who are uneducated, unwilling, who have their own biases, and sometimes are refusing treatment, for reasons that are unjustified. And so accessing care can become particularly stressful for members of this population. Suicide rates among transgender populations in particular are high. We are seeing where that population, is dealing with, trauma in their community. They're being hit with traumas on the national level. When you think about conversations that are going on now about whether or not they should be allowed to play in sports. Individuals with marginalized identities, whether it's racial or ethnic identity or a gender identity or sexual orientation identity, are directly impacted by what's happening at the national level with policies that are being created that have direct impact on the emotional well-being and functioning of those populations. And so that is something that I think we really need to be attentive to. And certainly something that I think, as a profession, we need to start, really kind of focusing on how we can best serve the needs of those populations.
Oh, really important, that intersectionality, right? That we really need to pay attention to. No one comes in the room with a single, frame and issue, right? There's a lot coming into the room, and mental health care professionals have to be prepared and supported in being able to provide, to understand that, right? And to adapt potentially existing treatments and approaches to be able to address those things. So I think those are really important populations to think about. There are many others, I'm sure, as well. But I think we're close to the end here. So I wanted to give you each a chance to perhaps raise any closing thoughts or any tips or ideas that you would like to share with our audience before we close.
I just want to really kind of emphasize the importance of seeking assistance, professional treatment, if you do find yourself struggling, with your mental health. If you're noticing things like, you're having problems sleeping, or, your appetite is a little off, your mood might be a little off. Certainly, if you're having thoughts of harming yourself, harming other people, you certainly want to take the steps that are necessary to keep yourself safe. Everyone struggles from time to time. We don't hear that enough, I think. This idea of just kind of normalizing the importance of our mental health and seeking that treatment. There are lots of resources out there. Since 2020, we've seen a lot of attention being paid within the African American community in particular on how to go about accessing care, with providers who hold similar identities. That's important to some people. So there are lots of networks out there that can connect you with a provider of your preference.
Thank you. That's very, very important advice. And, the more that people can recognize that there is help available, right? I think that's really important. Elena?
I'd like to speak to the providers who are out there, not just for those of my community, but allies of the community as well, to really educate yourselves, take care of yourselves, but educate yourself on the needs. You don't have to speak Spanish. I'm speaking about the Latinx monolingual community. You don't have to speak Spanish to work with the community. You can immerse yourself in the needs. You can read, you can attend webinars to learn ways of being an ally, being a supportive community member, and to being a supportive provider. And it starts with asking the right questions and looking inward about what are some of the ways that I might interact with my clients that might be different from somebody who looks like me, from somebody who doesn't. So learning how to educate yourself and get well-versed in the needs of the community is very important.
Great. Thank you so much. I really, really want to thank both Dr. Donya Wallace, Dr. Elena Herrera for joining us today for this really informative and important discussion on mental health disparities. We will be posting some resources, and a recording of today's webinar will be mailed to everyone in a few days. And you'll be able to find this panel discussion and others in our series on PAU's YouTube channel. If you have further questions, feel free to email us at externalaffairs@paloaltou.edu. Thank you all very much.